Have you ever woken up in the middle of the night feeling the need to urinate? While many people assume this is just a natural part of aging, frequent nighttime urination can sometimes be a sign of something more serious. A condition that affects millions of men worldwide, prostate cancer. Though not pleasant to think about, prostate cancer is one of the most common cancers among men over 50. The encouraging news is that when detected early, it can be effectively treated. The key lies in recognizing the early warning signs before it's too late. In this video, we'll look at 10 silent warning signs of prostate cancer that are often overlooked. If any of these symptoms sound familiar, it's important to take them seriously and get checked. Early detection can make all the difference. Sign 1, burning or painful urination. If you've ever felt a burning sensation or pain while urinating, it's easy to dismiss it as a simple infection or a result of aging. However, it can also be one of the earliest indicators of prostate cancer. When the prostate becomes enlarged or cancerous, it can press against the urethra, blocking the normal flow of urine. This pressure may cause irritation and pain. Over time, if left unchecked, it can lead to infections or even more severe complications. So if you experience pain or burning while urinating for more than a few days, it's wise to consult your doctor. Paying attention to this simple symptom could lead to early detection and effective treatment. Sign 2, frequent nighttime urination. Waking up multiple times at night to urinate can disrupt sleep and leave you feeling drained the next day. While it's common to blame this on aging or drinking fluids before bed, it could also signal a problem with the prostate. Generally, 1 or 2 nighttime urinations may be normal for men over 60, but if you find yourself waking 3 or more times every night, and this continues for weeks, it could be a sign of prostate enlargement or early cancer. If you're constantly tired from interrupted sleep, it may be time to pay closer attention to your body. A simple checkup can offer peace of mind and detect issues before they progress. Sign 3, blood in urine. Noticing blood in your urine can be alarming. Sometimes the amount is so small it can only be seen under a microscope. But whether visible or not, it should never be ignored. Prostate cancer can cause tumors that press against the bladder or urethra, leading to blood in the urine. Even a single episode is enough reason to seek medical advice. Remember, early detection often begins with small, unexpected symptoms like this one. Sign 4, lower back, hip, or leg pain. Persistent pain in the lower back, hips, or legs is often mistaken for muscle strain or the effects of aging. But when such pain lingers without a clear cause, it could be a warning sign of advanced prostate cancer. As the disease spreads, it can reach the bones, especially the spine, causing dull, persistent aches that don't go away even with rest or medication. If you experience unexplained pain that refuses to subside, it's time to listen to your body and get checked. Sign 5, unexplained weight loss. Losing weight without changing your diet or lifestyle might seem harmless, even welcome. But sudden, unexplained weight loss can be a serious indicator of underlying illness, including prostate cancer. As cancer cells grow, they consume the body's energy and interfere with metabolism, causing fatigue and loss of appetite. If you lose more than 5% of your body weight within 6 months without trying, consult your doctor. Your body may be signaling distress long before more obvious symptoms appear. Sign 6, pain or discomfort in the rectal area. Prostate cancer can also cause pressure or discomfort in the rectal area. Some men describe it as a dull ache, bloating, or a feeling of fullness. It may even come with digestive disturbances or constipation. Because these symptoms resemble common stomach issues, they are often ignored. However, persistent or unexplained discomfort, lasting more than 2 weeks, deserves medical attention. Getting examined early can rule out serious problems or help detect cancer before it spreads. Sign 7, pain when sitting for long periods. Pain or numbness in the pelvis after sitting for long periods may seem like a minor issue. But if the discomfort persists, it could indicate that the prostate is enlarged or under strain. A growing tumor can press against nearby tissues, causing a feeling of heaviness or pain in the pelvic region. If you notice that sitting for extended periods becomes uncomfortable or painful, especially in the perineal area, it's worth getting checked. Sign 8, difficulty starting or maintaining urine flow. Struggling to start urinating or experiencing a weak, intermittent stream is a classic sign of prostate obstruction. When the prostate enlarges, it can narrow the urethra, making it difficult to urinate normally. If you often find Yourself waiting for the flow to start or feeling incomplete emptying after urination? Don't dismiss it as normal aging. These could be early signs of prostate problems, including cancer. Prompt evaluation can help you find the cause and treatment before it worsens. Sign 9. Loss of bladder control, incontinence. Incontinence, leaking urine when coughing, laughing, or before reaching the toilet, can affect self-confidence and quality of life. For older men, it may also point to prostate issues. In some cases, prostate cancer or its treatments can affect the nerves and muscles. Controlling the bladder. If this becomes a frequent problem, seek medical advice. There are effective treatments and lifestyle adjustments that can help you regain control and comfort. Sign 10. Painful ejaculation. Pain or burning during or after ejaculation is not normal. It may be mild at first, but if it persists, it could be related to prostate inflammation or cancer. When the prostate or nearby ducts become affected, it can cause discomfort in the lower abdomen, penis, or testicles after ejaculation. Even if it happens occasionally, it's worth mentioning to your doctor. Detecting the cause early is always better than waiting until symptoms worsen. Understanding how prostate cancer develops. Prostate cancer begins when normal cells in the prostate start multiplying uncontrollably instead of dying as they should. Over time, these cells form a tumor. If untreated, the tumor can invade nearby areas, such as the bladder, rectum, or spine, a process known as metastasis. The danger lies in its silence. In the early stages, prostate cancer often shows no symptoms. That's why regular screening is essential. For men over 50, routine checkups, including PSA tests, can help detect problems long before they become life-threatening. Risk factors such as age, genetics, obesity, and race can increase vulnerability, but awareness and timely action can change the outcome. Final message. Prostate cancer develops quietly, but it doesn't have to claim lives silently. By recognizing the warning signs, listening to your body, and getting regular checkups, you can protect yourself and those you love. Health is the most valuable asset we have. Don't ignore the signals your body sends. Early action saves lives. If you found this information helpful, share it with others. It may help someone recognize the symptoms and seek help before it's too late. Thank you for watching, and remember, awareness is the first step toward prevention.